Then indication for external fixation in open fracture. Primary internal fixation in open fracture and indication for internal fixation in open fracture. Other form of the fractures, that is immobilization, and about the fixation methods in open fracture. The point to be remembered, an interesting treatment guideline the world over the open fracture, definitive wound care, criteria for primary closure, approach to a polytrauma case, dislocation, types of dislocation, common traumatic dislocation in that area involved, and the type of the dislocation table. Then typical deformities in the dislocation, subluxation, sprain, strain, its definition and its importance thing. Then complication of the fracture. So next topic is the complication of fractures. In the complication of the fractures, firstly, the introduction is very important. Then acute respiratory distress syndrome, Oltmann's ischemia or compartmental syndrome, non-union, avascular necrosis, traumatic myositis ossificans, then malunion, other important complication of fractures, deep vein thrombosis and pulmonary embolism, injury to the blood vessels, injury to nerves, complication peculiar to open fracture, shock, gangrene, gas gangrene, tetanus, and the crush syndrome. So, in that, firstly, we was learn about the fracture, and now we will study about the complications of the fractures. Where is other student? Hmm? There no need of lecture. बोला बोला काय झालंय? Student join fast. It is a very important topic, that is complication of the fracture. Fracture is disturbing event more so if it is developed complications. The complication could be immediate or delayed. Immediate complications are life-threatening and delayed complications are more mortal. So fracture is a very disturbing event. complication is maybe immediate or maybe delayed. When the immediate complication, then it is life threatening, and delayed complication is also more mortal. Some complications develop at the time of the injury and are beyond the control of the surgeon. They need to be accurately diagnosed and treated. So whenever a surgeon encounters a case of the fracture, he should look beyond the fracture and try to detect complication if any. The following are the common complications. First one is a acute respiratory distress syndrome, that is fat embolism. In ARDS, that is acute respiratory distress syndrome, is defined as a post-traumatic distress syndrome occurring within the 72 hours of skeletal trauma. It indicates the presence of flat globule, that is palmitin and stearin in children and olein in adults, and within the lung parenchyma and peripheral circulation after a long bone fracture. So, ARDS is defined as a post-traumatic distress syndrome. It is a occur after the post-trauma, and it occur within 72 hours of skeletal trauma. And it indicates the presence of the flat globules, that is palmitin and stearin in children. It usually manifests within the 24 to the 48 hours, but sometimes may be delayed for several days. So, the ARDS manifests within 24 to 48 hours, but sometimes may be delayed for several days. ARDS is a dreaded complication often associated with multiple fractures, major bone fractures, pelvic fracture, multi-system injuries like chest and abdomen, and head injuries, etc. It is seen in 10 to 45% cases of multiple fracture and is an important cause of morbidity and mortality. That is 11% in a multiple fracture and multi-system injury. So the ARDS is a dreaded complication which is associated with multiple fracture, major bone fracture, pelvic fracture, and multi-system injuries like chest, abdomen, and head injury. And it is seen in 10 to 45% cases of multiple fracture. So it is important cause of the morbidity and mortality in 11%, that is in multiple fracture and multi-system injury. So this is a diagram of the petechial rashes. This is a petechial rash. This, these are the hallmark of fat embolism syndrome, which is seen in ARDS. Then Holtman ischemia or compartmental syndrome. Mubarak defined compartmental syndrome as an elevation of interstitial pressure in a closed occipital compartment that results in microvascular compromise and may cause irreversible damage to the content of the space. Its site is firstly anterior and the deep posterior compartment of the leg. Second is the volar compartment of the forearm. Third one is the buttock, shoulder, hand, foot, arm, and the lumbar paraspinous muscles are relatively rare sites. So, Wolfman ischemia or the compartmental syndrome is elevation of interstitial pressure in the closed ossificial compartment. So, which results in microvascular compromise and may cause irreversible damage to the content of the space. And besides that, anterior and the posterior compartment of the leg, in that olar compartment of the forearm, then buttock, shoulder, hand, foot, arm, lumbar, parasinus muscles are relatively rare sites. Then compartmental syndrome of the forearm. So this is the one of the most dreaded complication in orthopedic and which ranges from mild ischemia to severe gangrene. Early recognition and prompt remedial measures is the key to successful countering of this problem. This is an orthopedic emergency. So, compartmental syndrome of the forearm is the most dreaded complication in ortho and ranges from mild ischemia to severe gangrene. And early recognition, prompt remedial measure is the key to success the countering of this problem. So this is an orthopedic emergency. So definition is that it is an ischemic necrosis of the structures contained within the volar compartment of the forearm. So this is a diagram of the Holtzmann ischemia, that is compartmental syndrome. So this is a clinical photo which shows the VIC of the forearm, and it is the X-ray, that is a radiograph of the Holtzmann ischemia. So in that case we can see how it is present and or it is how it is seen in the X-ray, that is radiograph, that is Holtzmann ischemia or compartmental syndrome. Student, hello, हॅलो स्टुडंट, तुमचं 3 ते 4 लेक्चर कोण घेतं? 3 to 4 PM कोणी सांगू शकेल का मला? हॅलो, बोला. सुप्रिया, प्रज्ञा, हिरा, 3 to 4 लेक्चर डेली कोण घेतं तुमचं? 3rd year BHMS. माझा आवाज येतोय का सगळ्यांना?
येस मॅम.
कोण बोलतोय? सायली.
हा मॅम बोला.
3 to 4 डेली कोण लेक्चर घेतं तुमचं?
3 to 4 नाही. शिंदे मॅम कधीतरी घेतात.
शिंदे मॅम कसलं लेक्चर
मॅम
शिकवतात? हॅलो,
हा
कोणता सब्जेक्ट घेतात त्या?
ऑर्गेनॉन.
ऑर्गेनॉन. बरं कधी घेतात त्या? डेली घेतात का?
नाही, मंडे ट्यूजडे वेनसडे.
मंडे ट्यूजडे वेनसडे. ओके. फक्त 3च दिवस घेतात पहिल्यापासून?
हो.
थर्सडे फ्रायडे सॅटर्डे कोणीच नाही घेत का?
नाही.
बरं बरं, ठीक आहे, चालेल. जर कोणी घेत नसेल ना 3 to 4 PM, तर थर्सडे फ्रायडे सॅटर्डे मग मी घेते आपलं ऑर्थोचं लेक्चर किंवा ऑप्थल्मो घेते. मॉर्निंगचे
ठीक
लेक्चरचा
आहे.
थोडा प्रॉब्लेम होतोय मला क्लिनिकमुळे. ठीक आहे. हॅलो.
हो मॅम चालेल.
हा, तर मग आपण असं करू की आपलं मॉर्निंगचं थर्सडे फ्रायडे सॅटर्डे जे लेक्चर होतं ना, ते आपण 3 to 4 घेऊया. चालेल.
हो ठीक आहे. हो.
बघते मी कसं काय जमतं ते, बोलते मी शिंदे मॅडमशी पण. त्यांना काही प्रॉब्लेम
ओके.
नसेल तर मग घेता येईल आपल्याला. ते नक्की डेली घेत नाही ना?
नाही डेली नाही. मंडे टू वेनसडे.
मंडे टू वेनसडे. ओके, फर्स्ट 3 डेज. मग फर्स्ट 3 डे आपण 2 to 3 घेऊ आणि नेक्स्ट मग 3 to 4 घेऊ, असं करूया. ओके.
ओके.
थोडं माझं
हो हो.
पेशंटचा थोडं प्रॉब्लेम होतोय त्यामुळे.
अच्छा. ओके.
ठीक आहे, मी बघते, मी बोलते त्यांच्याशी. हं? तर मग आता आपण आजचं लेक्चर इथे स्टॉप करूया आणि पुढचे कॉम्प्लिकेशन आपण नेक्स्ट सेशनमध्ये घेऊया, दॅट इज नॉन युनियन एनालिसिस. ओके, सो वी कॅन
ओके
स्टॉप
मॅम.
हिअर. हॅव अ गुड डे.